Hello and welcome back to another video. Today we're going to be learning how to do a Foley catheter insertion and removal of a Foley catheter. We're always going to start by verifying our doctor's orders, and we're going to make sure that we are doing the procedure that the doctor has ordered us to do. We're going to walk into the room. We're going to introduce ourselves to the patient. So I just walked into the room. Hello, my name is Destiny. How are you doing? I'm doing good. Okay, well, I'm gonna go ahead and provide for your patient privacy by closing this curtain. And then I'm gonna do my hand hygiene. I'm going to identify my patient using two identifiers, such as the name and the date of birth. So, can you tell me name and date of birth? Yes, my name is Mrs. Avondale, and my date of birth is July 15th of 1920. Okay. Do you have any allergies? No, I'm not allergic to anything. Have you ever had iron or iodine put on your skin? No. Yes, I have, and I'm not allergic to it. Okay, that's great. The next thing I'm going to do is I'm going to explain the procedure to the patient. So today we're going to give you a Foley catheter because you've been having some trouble retaining fluid in your bladder, and it's causing you distension, and it's making it really hard for you. So we're going to go ahead and do that. What we're going to do is we're going to insert a catheter, and that's going to help your bladder drain. Is that okay with you? Yes, that's okay with me. Okay. So the next thing we're going to do is we're going to examine the patient by using a bladder scanner. And so, bladder scanner, where we're going to palpate the patient's bladder for distension. We're going to raise the bed to a comfortable position. Then we are going to drape the patient for privacy. And place a waterproof absorbent blue pad or towel underneath the patient. So we can do that right now. Okay. And then we are going to gather up our necessary equipment and supplies. We're going to position the patient. So since this patient is a female, we're going to have her on her back with her legs, with her knees apart and her feet touching. Since she has short legs, they're going to stay like that. So now we're going to apply clean gloves. Okay. We're going to apply our clean gloves. And what we're going to do now is we're going to wash the perineal area with soap and water. Then we're going to clean the labia and urinary meatus, working from the clitoris towards the anus. So we're going to go ahead and do that right now. We have our water and our wash rag. And we are going to dip it in the water, make sure it's wringed out pretty good. We're going to start from this side. We're going to go down towards the anus. And then we're going to switch sides of the of the rag. We're going to do the other side. And then we're going to switch sides of the towel again. And we're going to go straight down the middle to the bum. And then after we're done with that, we're going to get rid of our gloves. And the towel we used goes to the linen, and we're done with all that stuff. And so we're going to perform our hand hygiene. Okay, so then we're going to start with the kit now. We're going to I don't know if you can see this. We're going to open the outer wrapping of the kit by tearing the edge of the plastic wrap. And we're going to take the kit out of it. And what we're going to do with this is we're going to turn it into a trash bag so that we don't break our sterile field. Once we've established our sterile field, we want to make sure that we're not breaking our sterile field. So I'm going to put this over here so that I can throw my used supplies in it. And now we are going to open our, what is this called? Our catheter kit. I don't have a bedside table, so we're just going to do it on the bed, but if I had a bedside table, we'd be doing it on the bedside table. This is above my waist, though, so at least we got that going for us. So what we're going to do is we are going to open the inner sterile wrap using sterile technique to create a sterile field. Then using sterile technique, we're going to open up the top flap to the far side of the kit. And then open the side we're going to open this side, make sure it's an inch away from us. And then this side. And then away from us. And we're going to make sure that nothing is touching our sterile kit. Or sterile filled. Now we are going to apply the sterile gloves. Okay, so I'll open the sterile gloves over here. We're going to go ahead and put this underneath our patient. We're going to put this shiny part up. I believe I remember her saying that. Okay, now we're going to open our sterile gloves. Okay. And now that we have our sterile gloves, we're going to we're going to arrange all of the supplies on a sterile field, maintaining the sterility of gloves. We're going to open the packet of lubricant and squeeze it out onto the sterile field. Okay, so we'll do that right now. Pretend that my gloves are still sterile because I need to move the camera in order for you to see what I'm doing. Okay, so if the camera had never moved, my gloves would still be sterile. Okay, so praying hands. Now we're going to, why do we have two of these? Oh, because this one was for the boy. Okay, we don't need this one. We're getting rid of this. Okay, now we're going to get our lube. Which one's the lube? I think this one's the lube. And we're going to squeeze it in here. Squeeze. And then we're going to throw this away without contaminating our gloves into the sterile bag. And then next we are going to pour the iodine onto our cotton balls, and we are going to throw this away into our sterile bag over here. Okay, and then next, pretend I didn't touch my hair. Next we are going, I can't believe I did that. Next we are going to remove the sterile wrapper of the container. So I guess that's this. Let's scoop this over. And we're going to take this off. Take this off and put it back in our thing. Throw this away. We are going to take this off. We're going to uncap this. And we are going to plug it in to our catheter. Okay, make sure that's still in there. Next, we are going to get ready to put our Foley catheter into our patient. I'm going to move the camera to get a close-up. Okay, so what we're going to do is we are going to place our hand and we're going to spread open the labia and to get a better look at where we're going. We're going to put lube on the end of our catheter. So putting lube on. We are going to take the cotton balls, and we're going to clean. Throw that one away. Get another cotton ball. Clean. Throw it away. More cotton balls. And we are going to clean the middle. And then we are going to take the rest of the cotton balls, all of them, and we're going to clean the middle again. We're going to throw all of this away, even this. We're going to throw it all away. So since we've already lubed up our catheter, now we can insert our catheter. inserting, pulling our hands back, inserting, pulling our hands back, inserting, pulling our hands back. Now, we're going to take our non-sterile hand, we're going to push and make sure that we got all of this liquid into the port. And then with our sterile hand, we're going to pull back and make sure that it's in place, and it is, and we're going to push back in an inch or so. And then we are done. So, oops. Let me see. Now we're going to make sure that our Foley is coming across the patient's thigh. We are going to secure our catheter with a Foley anchor, and we are going to well, I don't have anything to hold it in place, but we're going to pretend that we put a Foley anchor on here. And we're going to take our bag and we're going to connect it on the appropriate railing for that, but not the side rails. We never put a catheter on the side rails because the patient could pull up or down the side rail and it could really mess up our catheter. But now, we're going to help the patient into a comfortable position. We're going to get rid of all this trash. We're going to take our gloves off. We are going to perform our handy dandy hand hygiene. So we're going to wash our hands. Washing our hands. We're going to make sure that the patient is comfortable, that they have everything they need, that they're in a comfortable position. And next, I am going to show you how to take out a catheter. So, first things first, like we're always going to do, is we're going to verify our doctor's orders. And so the doctor has ordered us to take out this catheter that we put in a couple of days ago. And so we're going to gather our necessary equipment and supplies. We're going to perform our hand hygiene performed. We're going to provide for our patient's privacy, so we're going to close the curtain. We're going to introduce ourselves to the patient. Hello, my name's Destiny. I'm going to be your nurse today. We are going to identify the patient using 2 identifiers, and we're going to verify the allergies. Hi, can you tell me your date of birth? They tell me. It matches. I'm going to explain the procedure to the patient. So today we're going to take out your catheter. Do you agree to that? Yes, that would be great. Okay. So, we are going to raise the bed to a comfortable working position. And we did. And then we are going to apply our gloves. So applying our gloves. We are going to put a waterproof pad underneath the patient's bottom. And we already did that because we put this nice brown towel underneath our patient. So putting the towel. We're going to help our patient into a dorsal recumbent position. And so they're already in the position. So we're going to remove the catheter securing device. So we're going to take off this Foley anchor. And we clean it and make sure it's okay. Then we're going to perform catheter care or peri-care on our patient. So, water, clean towel, dip the water into the bucket, drain, make sure there's no running off. We're going to come over here and we are going to clean this side, switch sides of the towel, clean the other side, switch sides of the towel, go down the middle. Okay, and now our peri-care has been performed. So now what we're going to do is we're going to empty the drainage bag. We don't want urine everywhere, so we're going to empty the drainage bag. We're going to measure it, and we're going to record the amount that came out of the catheter bag. So now we are going to remove the catheter. So what we're going to do is we're going to take a syringe and we are going to empty the balloon. If I can find the syringe, what did I do with it? Crazy girl. Oh no, did I throw it away in the big trash over here? Oh goodness. Where's it at? Okay, I found it. Okay, so we're going to get our syringe. We are going to connect it into the catheter and we're going to let it drain on its own. I said just drain on its own. All the water should just come right on out. So we want to get the same amount of fluid out as we pushed in, and we did. So now we're going to tell our patient, okay, it's time for you to exhale slowly, and we're going to pull the catheter out smoothly and slowly. So we're going to go ahead and pull our catheter out. We're going to look at our catheter, and we are going to make sure that the catheter is still intact. Once the catheter is removed, we're going to wrap the contaminated catheter in a waterproof pad. We're just going to pretend this towel is a waterproof pad and we're going to wrap it up. So next thing we're going to do is we're going to clean the perineum with soap and water. So we're going to get some more clean water, some more clean towel. We're going to dip it in the water. We're going to clean, switch sides, clean, switch sides, and down the middle. Okay, and then we're going to grab another clean towel and we're going to pat dry. And then we're going to help the patient into a comfortable position. So, help the patient into a comfortable position. You look mighty comfortable. Okay, we're going to take our gloves off. And we are going to, you guessed it, we're going to perform hand hygiene again. Yay! Lots of hand hygiene. You don't want to infect people. Great. And so now we are going to place the call light within the patient's reach. And we are going to use this as a call light. We're going to pretend this is a call light. So we're going to dispose of all the contaminated material that we used. And we're going to leave the patient's room nice and tidy. If you have anything you need, you let me know, okay? And when you pee, I want you to let me know how much you peed, and what time you peed. So please just push your button, call us whenever you have to go to the bathroom. We'll put a hat in the toilet to make sure that we collect the right amount. And if you need anything until then, you let me know, okay? Okay. So, thank you for watching my video. I will see you on Tuesday whenever it's time to make a final video. Goodbye.